Hi everyone, my name is Carolina and my topic is about depression. Depression is a mood disorder that causes persistent feelings such as sadness and loss of interest. Clinical depression is a significant type of depression. The disease affects how people feel, think, and behave while contributing to physical and emotional problems. It caused by certain medications, death of loved ones, abuse, and other mental illnesses. The signs and symptoms include a hopelessness, outlook, decline in weight, increased fatigue and anxiety, changes in diet, and irritability. Between 2007 and 2016, the prevalence rates of depression have affected all genders in the United States. Women are 70% more likely to develop depressive symptoms during their lifetime. Depression in the United States alone affects 17.6 million Americans each year, or 1 in 6 people. Many neurotransmitters linked to depression, such as serotonin, dopamine, and norepinephrine. The illness creates imbalances in the brain due to problems it causes to the neurotransmitters. Other neurotransmitter systems, including glutamate and gamma-aminobutyric acid, have further been implicated in depression. The drug used for treating the disorder includes selective serotonin inhibitors. Examples are Paxil, escitalopram, and paroxetine. They treat the disease by increasing serotonin levels in the brain. The carrying of communication signals across the nerves would rise due to the SSRI's use. The drugs work by decreasing dopamine, leading to an improved cognitive and behavioral process in individuals. The disorder accompanied by the reduced size of the brain sections, which are vital for regulating cognition and mood, such as the hippocampus and the prefrontal cortex. The outcome will be a decline in neuronal synthesis in the above brain areas. The SSRI are effective in treating depression and further social anxiety, PTSD, generalized anxiety, panic disorder, and obsessive compulsive illnesses. These common drugs can tolerate because they are safe for any medically ill patients, and their overdose is not disastrous. The risks of the drugs include nausea, restlessness, increased headaches, and tremors. They can as well lead to a possible risk of suicide. Other risks are the loss of productivity in human beings, economic suffering, and inability to get jobs. It might further be risky as SSRIs encourages heart problems and the patient will not be able to overcome the severe illnesses. The use of drugs can make patients face significant side effects such as feeling agitated, blurred vision, loss of appetite and weight, indigestion, constipation, and dizziness. Extensive use of the SSRIs has been linked to the higher risk of dementia, especially when using the Paxil antidepressant. Without using drugs, depression is risky as other complications can get worse in a person. Behavioral and health problems can be encountered in all areas of life by a patient under untreated depression. Untreated patients will have a higher risk of death than those treated. Untreated depression can be beneficial as it reduces substance abuse, family problems, excessive weight gain, and social anxiety. The mortality rate related to anxiety and depressions, according to studies, is 1.6%. Approximately 800,000 people die due to depression-related suicide every year, globally. Among the people aged 12 to 29 years old, depression-related to suicide is found as the leading cause of death. Study shows that men over the age of 65 years old are at a higher risk of committing suicide when faced with depression. Other examples of antidepressants that can be used to treat the disease are ginkgo biloba, B vitamins, zinc, and 5-HTP. Honey can be useful for mental health as researchers have argued that it can help prevent the onset of the illness. Honey is essential because it is natural mood enhancer. The sweet sugars in honey provide a quick boost of energy, which can easily change the mood and other depressive feelings. To prevent getting depression, doctors encourage the use of mindfulness-based cognitive therapy. The MBCT helps in changing the way people think and prevent them from focusing on negative thoughts. Changes in lifestyle and nutrition, according to research, have managed to avoid the rates of depression by 25%. Thank you all for watching.